Hi, my name is Danielle Nash, and I'm just getting done reading the 2 or 3 articles that we're reading for our post this week. And I guess I'll kind of talk first sort of about the controversies in psychiatry and the DSM-5. Um, I definitely thought I think it's so interesting, and I think the political climate of today really has got us all kind of thinking a little more critically about the connections that our professions have to sort of like corporate America and the underlying money and politics behind things. And I think this article kind of got me thinking a little bit about um, gosh, how insidious things like that actually are. You know, even when we're doing micro level social work and we're working with people clinically, we might be aware of sort of like obvious policies and politics that affect our profession, but things like um, you know, psychiatry is linked to pharmaceutical companies, and then how we use the DSM and how that sort of fuels more diagnoses, and then that fuels medical diagnoses, which then fuel more prescriptions being written and more prescriptions being consumed, and then medications being consumed to counteract those prescriptions. That's that's a pretty complicated way to sort of address the politics that are occurring in our profession, and the more critically I analyze areas of my own work, areas of the profession kind of at large, the more that these things sort of end up on my radar, and I find myself critically analyzing a lot of things. And I was really interested. The article talks about most psychologists using sort of the parameters as they're laid out by the World Health Organization, which, gosh, I don't remember what it's called, but apparently they have another diagnostic criteria that they use, and apparently that seems to be less corrupt. I'm not really sure, but I do think the way that we conceptualize disorders or diseases is really fascinating, and it's really delicate, and it's really powerful, and and I think that reading things like this causes me to think a lot about the power dynamic that is present when you're able to give someone any sort of label, and sort of um, that situation that arises, and just kind of keeping that on the forefront of my mind when I'm communicating with people, and recognizing that power dynamic, and really how meaningful and huge that is for people. Um, so I think that the mental health recovery paradigm, implications for social work article by Jennifer Carpenter, um, was really interesting, and I sort of have a hang up when it comes to things like this, and it's hard for me to understand this. I understand wanting to give more power to the peer movement, and really recognizing sort of experts by experience, and honoring that, and I think those things should be included, but I also think that being an expert of your own experience is very different than being an expert in a science or a soft science or a field that you have academically researched and spent a lot of time studying, and sort of looking at empirical evidence and longitudinal evidence and research. And so that's sort of a gray area that I feel almost mean saying that, but that's sort of a gray area that I struggle with, because while on one hand I feel like social workers should be very fluid and very open-minded and very all-inclusive, I also feel like there needs to be concrete parameters and ways to measure outcomes and specific criteria, especially if we're diagnosing things. And of course, all of these things in my mind are established in order for us to find appropriate ways to seek relief for people or help people seek relief for themselves. And of course, I come from a biology background and public health background, and so I definitely have that more critical, concrete lens than maybe somebody coming from like a softer science or a different field. But so I think it's hard as professionals to really honor the sort of juxtaposition that occurs between someone's personal experience and then sort of the diagnostic criteria and the label that they have to receive specific services or to, you know, even be treating them with a specific medication that you think might help. And so that's like something that's very, very delicate and needs to be addressed in my own practice as far as how to effectively navigate that while also, you know, being kind and reverent to people. But anyway, I look forward to reading more thought-provoking articles like this and having discussions with everybody. All right, thanks. Talk to you soon.